Hi, I'm Dr. Ramp. This video we're going through phase 2 of our lumbar stabilization protocol. So we're going to go into some stretches here. Dr. Bloom's going to model for me. The first one is a hamstring stretch from a seated position. So this should stretch the back of your legs. You're going to extend one leg out in front of you, perfect, and then keeping a nice straight posture using those methods we talked about in the last video, and you're going to lean forward from your hips. Good, and you should feel that stretch all the way down the back of your leg to about your knee. And then coming back up, the next stretch we're going to go into is for your glutes and piriformis, again seated. So this one you're going to put one leg and cross it over the other, just like that, perfect. Some people may not be as flexible as Dr. Bloom is. If you can only get your leg halfway up your shin, that's fine too, just go to your comfort level. From here you're going to drop the outside knee as far as it goes comfortably. Don't put over pressure on it and push it further than it wants to go. And then from here, same thing, nice straight posture and lean forward from the hips. Beautiful, and you're going to feel that stretch through the outside of your hip around into your butt. And come on back up. And then just make sure when you're coming out of these stretches, you're doing it slowly and not just flinging your leg around. Make sure you are doing both sides with all of these stretches. We're only demonstrating one side here for time purposes. Next, we're going to move into our standing stretches. So come on up. Another hamstring stretch you can do here is put your leg up on the chair. Same thing here, straight posture, and then you're going to lean forward, stretching the back of the leg. If you need balance help, make sure you have a wall or a chair nearby that you can hold on to if you aren't able to stand on one leg easily. And come on back up. Good. And then we're going to go into a hip flexor stretch. So there are a couple ways to do this. The easiest one to do is standing. You're going to go into essentially a lunge posture, 1 foot forward, keeping your toes straight in a line. Good. Make sure your pelvis is straightly lined up. Beautiful. Nice straight posture here. And then you're going to lunge forward here, making sure your knee does not go past your toe. If you need to scoot the leg out a little bit, you can. Dr. Bloom's looks pretty good here. And you should feel that through the front of your hip on this side. If you want additional stretch, you can raise your arm on that same side up towards the sky, perfect, and then lean away from that side. Again, if you need some balance help, make sure you have a chair handy or a wall that you can lean into. Good, and come on out of that. So all of these stretches you're going to hold for about 30 seconds. If you don't want to count that high, you can take 3 or 4 deep breaths while you're doing them. Make sure you're doing both sides evenly. If you have any questions on any of those, let us know next time you're here.